Joining me now from the Centers for Disease Control, Epidemic Intelligence Service Officer Rebecca Levine, Ph.D. Rebecca, when did you return home to America from West Africa?
I got home in the middle of September.
In the middle of September. So what were you doing there in West Africa?
I was doing epidemiology.
And what did that entail?
A lot of help and support of the local Ministry of Health to do contact tracing, to do data management, to help deal with resources and that type of thing. So
you were never really in direct contact with any of the Ebola patients per se?
That's correct.
So what have you been doing since you got back? What were you able to glean when you were there that may be some help for us in the United States?
I was one of the first teams on the ground in the particular country that I was in, and we really were there to get the system started almost. We were really the first people in from C.D.C, and the Ministry of Health there was eager to work with us, but they were facing a disease that they had never before seen in this area. So we were there to help start the contact tracing, to help get them the best data management so that they could really try to begin to get this epidemic under control.
Of course, you were sent to West Africa to do your job as a member of the C.D.C. Did it ever concern you at all about your safety in terms of your health going to this region that's been ravaged by Ebola?
Of course, it's always in the back of your mind, and it's very interesting how the culture has changed there, where among the healthcare workers and among the C.D.C. staff and the ministry staff, there's a no-touch policy. Nobody touches anybody else, which is really interesting to experience over a month where you don't get a pat on the shoulder, you don't get a high five. So we were really not engaged in any risky behavior, so I was never really afraid. But of course, it is always in the back of your mind somewhere. So
did you ever take any kind of personal protections while you were there? I don't know if you walked around in any kind of suit, guarding yourself from Ebola. Obviously, you weren't working directly with the Ebola patients, but still, you're in the region. Did you take any extra precautions?
So we're deployed from C.D.C. with personal protective equipment in the event that we need it. I had it with me. I had several sets in case I needed it, and I never used them.
So what about the proposed quarantine? Of course, the C.D.C. is against any proposed quarantine for healthcare workers coming back from West Africa. The White House is against any kind of quarantine for healthcare workers coming back from West Africa. Were you in any kind of quarantine coming back?
I was under a 21-day fever watch for C.D.C., so I had to check my temperature twice a day and report that to our occupational health clinic.
So there was no official quarantine. It was one of the self-monitoring situations.
Yes.
Do you think that works? We had a case of the doctor who came back from West Africa in New York, and he was supposedly self-monitoring, and then he went out and he went bowling, and he went a night on the town, and then the next day, I guess he had the fever. Do you think that this works, or do you think there should be something more strict, like a quarantine that's being imposed in New Jersey and in New York, among other places?
That area is really beyond my expertise. I'm really focused on the response and dealing with the response where the affected countries are, so I'm afraid I can't answer that for you.
What about a proposed travel ban? Do you agree with the White House and the C.D.C. when they say that the travel ban is something that would make the situation worse, even though we're allowing people from West Africa into this country at a clip of about 150 a day?
Again, that's beyond my expertise.
All right. So what is in your expertise in terms of Ebola that you can tell us that'll possibly allay some fears among Americans?
Well, as Dr. Frieden has said, the best way that we can help control the situation here in the U.S. is to do everything we can to help control the situation at the source in the highly affected countries in West Africa. And given my firsthand experience there, it seems like what we need most is resources there. They're just very short on beds to take care of patients and trained personnel who can actually take care of these patients. There are also shortages of things like ambulances to transport these patients. So the best that we can do from the United States to provide resources and personnel to help support the activities that are going on to help control the outbreak in West Africa is the best thing that we can do to help ourselves in the United States.
So would you go back again if you had the opportunity or were told to go back?
Yes, sir. I'm going back in December.
All right. Well, good luck. Rebecca, thank you for joining us.